Hi, my name's Julie. I'm a trainee clinical psychologist in my second year at the University of East London.
Why did you want to be a clinical psychologist?
So my first experience of what clinical psychologists actually do was working within a children and adolescents mental health team. And I think that was the first time that I really got a chance to see the different ways in which clinical psychologists can help. And that's what really drew me to the profession, especially being able to work with individuals and their families and working across the lifespan. And also working ways doing direct one-to-one therapy or doing research or working indirectly. So maybe doing work with teams, work with schools, work with care homes or residential homes or other agencies as well. So it was kind of being able to work in so many different ways and also think about different ways that we can kind of help reduce and manage the stress. And that's kind of what really drew me into it.
Top tips on getting relevant work experience.
I think a few things that I found really helpful is trying to get relevant work experience as early as you can. So I was lucky enough to do a placement year at university, and that gave me experience working directly with clinical psychologists and helped to apply for jobs after. I also think it's just kind of maybe being creative. It's sometimes really hard to get assistant psychology posts, but there's other ways that you can work with clinical psychologists. So it can be within research, it can be within clinical health settings. It can also be kind of outside the NHS as well, even though it's good to get NHS experience. One thing that I found helpful in terms of trying to get maybe jobs that were kind of honorary alongside my paid jobs is I'd look at paid jobs that are already advertised and then I'd contact the person there. So that was a good way to kind of get my foot in. And once there was a paid post that came up again, it was easier to apply for that job after.
Do's and don'ts for the DClinPsy application.
I'd say my tips for the DClinPsy application is making sure that you highlight all your relevant experience, even if you don't feel like the experience is necessarily, that specific. So there's so many things that you can reflect on in other experiences that might be relevant to clinical psychology or show that you have the skills for clinical training. I think the second tip is also making sure that you get someone who is either a trainee or a clinical psychologist to check through your form, just to make sure that you're reflecting on the best way that you can about your experience and not kind of just listing again what you've done on there. I think just also think about what you bring to psychology in general. There's lots of other bits in the form that you can kind of reflect on things that you're doing outside of maybe your normal job that maybe you can bring to clinical training.
Do's and don'ts for the DClinPsy interview.
I'd say my do's for the clinical psychology interview process is making sure that when you're answering questions that you're able to give really full answers. So really taking the questions from kind of showing your theoretical understanding of whatever they're asking you to also maybe think about kind of contextual and practical things that you can bring to it as well. So if there's examples from your clinical practice, if there's examples personally, making sure that you kind of mesh that with your kind of theoretical understanding of whatever they're asking as well. I think also try not to panic, which is kind of easier said than done, but it's an interview and it's an interview with probably people that you've worked with or studied under. So if you're just kind of seeing the panel as kind of as human as you can, and also thinking that some interviews are really short, so it can be 30 minutes or 45 minutes. So that's kind of the only time that you get to really kind of show what you know and why you want to do the training. I think I'd also say just interview day kind of practice is just trying to be around maybe people that are a bit calmer. I always find that if the atmosphere is good, it kind of helps the atmosphere getting into the interview as well.
What obstacles have you experienced on your journey to being a clinical psychologist?
I think some of the hardest things have been trying to get the relevant experience. I didn't personally have a paid assistant role. When I finished university, I did an honorary assistant role alongside paid jobs as well, so whatever I could kind of afford to do. And luckily they were quite flexible, but I was one of those people that would be able to get assistant interviews, but for some reason wasn't able to kind of secure the job after. So I just tried to think about the best ways I could still get the relevant experience. So a lot of that was kind of going through low intensity roles and then trying to think about how I can get the relevant experience alongside that. So trying to do kind of other bits of jobs, whether it's doing research or running groups with clinical psychologists alongside that as well. So I think that was kind of the biggest barrier. Well, it kind of felt like the biggest barrier of actually being on training. It kind of felt like actually they were really good experiences to have. But I think that was some of the kind of the obstacles, because in some of those roles you don't get the same contact with clinical psychologists, so you might not get the same benefits in terms of maybe having some interview practice or having someone to read your form. But it's also thinking about how there's other ways that you can get that experience or get that support from them as well. So how I overcame those obstacles, I think kind of like I said before, is just thinking about other ways to get that experience, but also personally kind of learning a lot of resilience, which I think kind of helped me for the doctor applications as well. Because I think you're kind of constantly getting that no and getting that feedback, but it also taught me about how to kind of develop my interview style, and working in different places taught me a lot about different ways of working within the NHS, and also showing that there's not one way that we work. And actually a lot of the experience that I did have was relevant for clinical psychology, even though it wasn't a traditional route in there.
How has your experience of training been?
I think it's been a journey so far. I'm in second year at the moment, so it's about a year and a half to go, and I think there's a lot that you learn in clinical training in so many different ways. So in terms of working with so many different client groups, learning how to kind of work with different supervisors, learning to be with your peer group, and learning academically. It's a lot that you're kind of juggling and learning, but it's kind of been really nice. I don't think I had the opportunity to kind of work in so many different ways before, and having that added responsibility of being a trainee as well. And also I think academically or kind of theoretically, there's been a lot of different ways of working or different ways of thinking about the stress or kind of wider inequality that I've had the experience to kind of learn about and have the space to really talk about openly, which has been really nice. At times it's been challenging as well. You have to kind of manage your clinical work, your deadlines, attending university, alongside kind of your own personal life as well. So it's been kind of tricky at times to try and make sure you get a good work-life balance on the course. But I think kind of overall it's been a really good experience. And I think a lot of development in so many different ways as well.
How has being from a BAME background impacted your training experience?
I think it's been on two different levels. I think one is not necessarily that explicit, but just being a minority in a space for a long time. I don't necessarily think it's been challenging, but it's just been something that I've been quite aware of. The fact that, there's only one other black person on the course. And it's a large cohort as well. So I think that's just one thing that you're kind of aware of all the time. I think in terms of challenges, there's a lot of kind of outcome and treatment disparities between black communities in mental health. And on one side, I'm kind of really fortunate that I'm in a course that talks about these disparities or have conversations about race or whiteness or privilege. But it's also thinking that actually you're having these conversations that are very uncomfortable with people that don't necessarily have those same experiences of being marginalised because of their ethnicity or race. So I think sometimes that can kind of have a big impact as well. Some of these conversations can be intellectual, so we can all kind of intellectually talk about the disparities that people have. But then if you have that kind of minority status or you've been marginalised in that same way, you kind of have to go home, or you still have to live it in your reality. So I think that's sometimes been challenging as well. And again, if you're seeing that on placement as well, so if you're working in inpatient wards or if you're working in secondary care teams and you're seeing actually that there's a large overrepresentation of a race, and you're kind of questioning or kind of trying to understand why that is, and again not seeing that same kind of representation reflected within the professionals in that team, they're things that can kind of really be quite challenging. I think the kind of ways that I manage it is just trying to seek forums of support. So trying to seek maybe other trainees, not necessarily just on the course. I'm really fortunate to have kind of some really people on the course that are really supportive, but also kind of seeking help other ways. I think sometimes when you're going through experiences or you're hearing certain things and you're kind of in the rush of the course, you've got deadlines, you've got placement, you don't necessarily get that time to process what you've heard or what you've seen. So that's a really nice way to kind of have that opportunity to reflect on and also think about how ways to respond to some of the things that are seen as well. I don't, not necessarily empowered, but I do think sometimes it's nice also to know that actually, even though there's not a lot of Black trainee clinical psychologists or clinical psychologists in general, that there's that opportunity to be that voice as well. So actually, if there are things that I can relate to or things that I can understand in terms of my own experience of being a Black woman or just a Black person or being an African person, then it's nice to maybe to have that opportunity to bring it up in conversations with the cohort or on placement, or being able to reflect on difference in general. So I think there's some of the ways that I kind of think about actually how can I manage this? How can I use some experiences that I have or some experiences that I've observed in the people around me or growing up to make sure that these conversations are being had and these uncomfortable conversations are being had thoughtfully and in ways that can help the people that we see in the population that we serve as well.
What advice would you give to your 16-year-old self?
I think at 16, I try and take as many opportunities as they come and try and get as kind of experience in different things that you could do. I remember being 16 and there were kind of loads of different schemes going on, like some kind of summer university schemes or different projects or chances to get involved in things, whether they were kind of creative or I don't know, more kind of academic or in different professions. So I think it's having a breadth of different experiences can kind of really give you an idea about what either work is like or what you're interested in and what you're good at. And I think that's kind of a good point where there's kind of less responsibilities or less pressure to do that. And I also think, again, kind of just not worry as much as before as well. Whatever you're kind of doing in the next step in terms of A-levels or going into university, you can always kind of think about how those experiences or your learning can still apply to some of the things that you want to do after as well.
What advice would you give to your aspiring clinical psychologist self?
I'd say kind of the first thing is just learning perseverance. It can be, for some people, it can be quite a tough process in terms of just kind of really knowing yourself and sometimes not always getting to the place or getting the experience that you want to get or getting the jobs that you want to get. But also kind of seeing it as a bit of a journey. It's actually a lot of the experience and a lot of the things that you do pre getting onto the Clinical Psychology Doctorate can really help you in terms of the clinical work that you do also after, and also thinking about what you can kind of teach the rest of your cohort and the trainees that you're with as well. So just kind of keep persevering, even if there's setbacks. A lot of those are learning experiences. Even though some jobs or some things that you're doing might not be exactly what you want to do, there's maybe lots of good things that you can get from those jobs or the work experience that you're doing as well. And I think just kind of the last piece of advice is just think about why you want to do clinical psychology and kind of keep that forefront. I think I found that the most helpful thing in terms of trying to make sure that I'm kind of persevering. So I knew exactly where I wanted to get to and why I wanted to get to that and kind of just holding on to that. And I think that's also helped to kind of carry me through the course and how I practice and the things that I do outside of the course as well. If you're thinking about actually maybe there's things that you like about the course or things that you might want to change about this profession or where you want to take that profession when you get onto the course, I think kind of holding that in mind can really kind of help you push through, and also can maybe open up some conversations while you're on the course and after to think about actually there's different ways of practicing, there's different ways of doing things that maybe you might be able to bring to this process as well.